Well, it's amazingly common. Probably at least 24 to 25% of men will regard themselves as ejaculating too quickly. Now, some of those men do not in fact ejaculate quickly. They may have a misunderstanding of what normal time to ejaculate is. But the message is that premature ejaculation affects far more men and their partners than was previously thought. Well, I think the prevalence of PE doesn't really vary according to age groups. I certainly see men ranging in age from 18, which is at the time of their first sexual experience, to men in their 60s, 70s and 80s. Probably the majority of men who seek treatment are aged between 25 and 35 years of age. But at that age group, men tend to have more sexual experiences. They tend to be in the early stages of a new relationship. They're keen to develop a relationship. So the level of bother that they have with premature ejaculation is maximal in that age group of 25 to 35 years of age. Well, duloxetine is a new tablet treatment that's been developed to treat PE. In fact, it's the first drug that's been specifically developed for the treatment of premature ejaculation. It's a tablet that's taken on demand, which means that you take it only when you want to have intercourse, approximately an hour or so before planned sex with a glass of water. And the clinical trial data that we have, which is substantial, covering more than 7,000 men, demonstrates that duloxetine is effective and it's safe, and it represents at this stage the best treatment for premature ejaculation. The clinical trial data that we have suggests that the average increase in time to ejaculation is a factor of 3 or 4. So someone who, for example, ejaculates in 1 minute will probably improve to at least 3 or 4 minutes. There will be some men who do better and some men who do not quite as well. Men can also expect that their ability to control, to delay ejaculation will improve, and that their level of satisfaction about sexual performance will substantially improve, as will their partners, and that the frustration, the embarrassment, the annoyance, the distress and the bother that they had before, which may have been responsible for their actually avoiding sex, will disappear as that satisfaction increases. Well, what the data shows is that each of the dimensions of premature ejaculation, time to ejaculate, a man's sense of control over ejaculation, his ability to delay and defer ejaculation, and how he feels about sexual function, whether he's frustrated, whether he's distressed or bothered, each of these things improve. The data we have is that men who have premature ejaculation following taking duloxetine will experience 3 to 4-fold increase in their time to ejaculate. Well, when you ask men a key question, has the treatment you've taken improved your premature ejaculation, about 40% will describe it as much or very much. So this is a significantly effective drug.